Hello and welcome back to Healthcare Kata. This is part 3 of a 6-part series. In the last video, we talked about some of the concepts related to the Toyota Kata approach, very kind of philosophical, I guess. And what I wanted to do in this video is get into more specifics using examples from my experiments in healthcare. So let's jump into the first one. My first experiment was about a year long. It was when I was the Director of Operational Excellence at an acute care hospital in the Dallas-Fort Worth area. Wonderful hospital. And I had the opportunity to kind of start from scratch, having no Toyota Kata experience or had no sensei to kind of guide us. What we did was we just kind of jumped in with both feet and kind of blindly and started practicing the kata. And I ended up doing about 400 coaching cycles, all of them in person because we were all on one campus at that time. And it probably took me like 399 cycles before I actually figured out what the heck I was doing. It was really tough. But we were able to get 25 learners, people that are leading the improvement effort, that are practicing the improvement kata. We were able to get 25 of those coached, probably 10 plus cycles for most of these individuals, 15, 20 cycles each. And they were from all over the hospital, from the ER, the OR, the inpatient units, you name it, non-clinical. And it was a lot of fun. I got to learn a lot about kind of what mistakes to make and what not to do. And I learned a lot from those trials and errors. And we even got a few coaches coached, where they were actually trying to practice the coaching kata themselves. And that was a whole nother level of difficulty there. So anyway, I wanted to get down to some specific examples of coaching engagements that I had that I think can help you see some of the good and the bad and the ugly, and hopefully you can build upon some of my learning. The first one is BMV compliance. So BMV means barcode medication verification, and basically you have a scanner, you scan the patient's armband and you scan the medicine's barcode to make sure that you're giving the right patient the right medicine. It's a patient safety thing, it's great. And we had already implemented it at the hospital, but one of the unit managers wanted to see the compliance with this protocol go up. As if it was not 100%, we wanted to go up always when it comes to patient safety. So they were excellent with patient safety, but they wanted it to be better. So we started a learner coach engagement, myself in the role of coach and the unit manager from the nursing division in the role of learner. And I was a new coach, he was a new learner, so we were kind of bad at it, honestly. And we started off, we didn't really grasp the current condition very well or understand the direction very well. We just kind of jumped straight into our target condition, which was we're going to increase compliance by delivering education, because this is all about just awareness, and we have new nurses, etc. And very typical of healthcare, jumping straight to the solutions. And we did that, and we didn't get a great result. We really didn't. We maybe saw a temporary spike in compliance, but we hadn't addressed any of the root causes because we hadn't really practiced the kata very well at that point. And so we said, let's not give up. This is one good thing of having a coach, is that the nursing manager was kind of like, well, we gave it a try, I'm going to move on to the next thing. But I was the coach. I was like, well, let's just try this again. So having a coach kind of keeps you moving forward. And so we said, let's actually really understand the current condition. Hey, what a novel idea. Let's go and observe the process. We had not done that. And so I started to become a better coach by recommending, hey, let's do the basics. Let's go and observe the process. Let's talk to the people, duh. And when we did that, of course, we found that there was a lot of process issues that had nothing to do with training or education or awareness. For example, some of the armbands were washing out after you gave the patient several showers. And so we didn't know why. And so we talked to people, and we would get one story saying, well, these armbands, they have been replaced, and the new ones no longer wash out. So we said, okay, well, let's try that for a little bit. And we tried the new armbands, but they kept washing out. And then so we kept doing these kind of cycles of going and talking to people and going and asking questions and observing. And eventually we did enough of these PDCA cycles where we realized that there had indeed been the wrong batch of armbands delivered, despite what some people were saying. And so we worked with the vendor to get them replaced, and it was a instant win, basically. As soon as we verified the root cause through these cycles of PDCA, we were able to isolate it and correct it, and we saw the problem get much less pervasive. And there was other issues still to deal with, and we continue to do other cycles to try to isolate those root causes. And in the end, it really was a win, and it was also a learning moment. I love when the nursing manager came to me and said, my whole career I've been just kind of thinking it was all about holding nurses accountable and holding them to a higher standard because they're trained professionals, and then all that's true. However, we need to also look at the process issues. That's what he was telling me, and it really just kind of made me happy to see that. And that's not something we talked about. It didn't deliver any education on that front. It was just through these learning cycles, basically, that he came to those realizations. And my realization, my lesson learned, was that PDCA is an excellent root cause analysis technique. I had always, as a facilitator, thought of root cause analysis something that, I would lead kind of like, with a group. We would do a 5 why together, or we would do a fishbone diagram, a bunch of sticky notes up on the board, and we would figure out exactly what the root cause was. Everybody would agree, and then we would develop countermeasures for that. And what I learned through the practice of the kata is that just by going out and doing these quick cycles of observation, these quick cycles of testing and talking to people, and these just really rapid 30, 60, 90-minute cycles of PDCA, we can actually isolate root causes that way. It's more of an empirical approach to root cause analysis, which was pretty eye-opening for me, and it kind of liberated me, I think, to say, hey, we've reached our knowledge threshold. Let's stop debating and analyzing on the board, and let's go out and actually try something and observe something and talk to some people, and let's go in that direction. So that was a pretty awesome lesson learned for me. And of course, it all comes back to this image again, which I'm going to keep referencing at the end of each video, which is that that revelation for me of the empirical approach to root cause analysis, it came because my brain was lifting weights. It came because I was viewing every step as an experiment. And because I was doing that, I was starting to get a little smarter when it came to coaching, when it came to facilitating improvement. And that was, I think, really just reinforced to me kind of the power of the kata approach. All right, so in the next video, we will get into another example from some of my experiments in healthcare.